Hello everyone, it's Dr. Dave. Hopefully you're all doing well, enjoying your week. Last weekend of February coming up. I hope you enjoy it. Coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update. It's Thursday, February 25th, 2021. I'm going to share with you 6 areas of health and wellness today. Somewhere around this video, you can read through all 6 areas. If you would like a copy, you can DM us on social, send us an email, or give us a call at the clinic. We'd be happy to get that to you. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, we will share with you some of the latest and greatest in the research and literature world when it comes to health and wellness, which might just stimulate, provoke, support your own decisions, actions, thoughts, and choices throughout the day with your health and wellness and maybe those around you. And when you spend some time making those good decisions based on some information that supports where you're going with your health and wellness, that could create an upward spiral of support for a healthy life, which is great use of your time and effort. All right, so a couple of areas if you're going to have children, already have children, going to be expecting children. They found a connection between folic acid intake and childhood allergies, according to the Frontiers in Pediatrics journal, January 2021. You may want to read that on the Daily Health Update or do some more research on that to see how it may apply to you. And as well, in the Journal of Pediatric Nursing, January 2021, they talk about the benefit of children with autism having a cat. There might be some benefits with that combination, so you can read about that and maybe do some more research on that as well. Sometimes we look at nutrition on the Daily Health Update and how it can be a contributing factor to some conditions like heart disease and stroke, for example. We know nutrition plays a big role, and fried foods are linked to those two conditions. Researchers analyzed data from several long-term studies and found that for each additional serving of fried food and individual averages each week, the risk for cardiovascular events, heart disease, and heart failure increases by 3%, 2%, and 12% respectively for those conditions. So for every intake or serving of fried food that a person averages during the week, those 3 conditions have increased likelihood of increasing. Increased likelihood of increasing. An increased likelihood of probably happening. And that's from the journal Heart, January 2021. So watch your intake of fried foods is the message there. And if someone does have a stroke and they're doing some recovery, the rehab should include some exercises, according to a study that included 24 adults with a history of stroke. Engaging in the same cardiac rehab program commonly prescribed to heart attack survivors can lead to a significant improvement in physical function, which can reduce the risk for a future stroke and other cardiovascular issues as well. That from the Journal of the American Heart Association, January 2021. So fitness is great as a preventive and lifestyle measure, but can also play a role in rehabilitation, and not just physical accidents and injuries, but other impairments to our quality of life through health events like strokes. So be sure you find out from a qualified healthcare provider what role exercise can play in conditions that you may have experienced, including stroke. And the International Journal of Reproductive Biomedicine, January 2021, looked at the importance of having a good strategy for healthier bones. An animal study found that bone mineral density improved in postmenopausal rats that exercised and were provided calcium and vitamin D supplements. The findings suggest that the combination of vitamin D and calcium supplementation with exercise may promote healthier bones and reduce the risk for osteoporosis. A common strategy that's been shared with people, and it seems that the evidence continues to support that approach will be good for you in trying to decrease how much mineralization you lose over time from your bones. And finally, neck disability is common with people who have jaw disorders, temporomandibular disorder. According to the Oral and Maxillofacial Surgery Journal, February 2021, they did examinations of 60 temporomandibular disorder patients and revealed that most experienced moderate to severe impairments in the neck function as well, with a correlation between temporomandibular disorder symptom intensity and the neck disability. Past research has demonstrated that treatment to restore how the neck is functioning can benefit patients with temporomandibular disorders. So if you're having some jaw joint problems, pain, clicking, locking, or other such issues, even if you're grinding or you have some clenching. Wouldn't hurt to have your neck function assessed, because there may be a connection and some further improvement to both conditions with appropriate treatment. All right, that's your daily health update to wrap up the video daily health updates for this week. Tomorrow we'll throw a written version at you with some good information for you to peruse and hopefully support your good health activities through the weekend. Hope you enjoy the last weekend of February. Go out and have some fun, create some good memories and experiences. And we'll catch up with you Monday next week, beginning of March 2021, with your next daily health update then. In the meantime, take care, be well, and we'll talk to you soon.